Welcome to the TheOMMedicine's module on smoking cessation. Now, while this topic may not be as high yield as some of the systems lectures like those on cardio or GI, there's always going to be one or two questions on how to best approach a patient who smokes, what pharmacologic agents can you use to help them stop smoking, and so we'll cover all of this in this module. One of the widely accepted ways for physicians to help a patient stop smoking is to go through all of the 5 A's, so let's go ahead and do that now. The first is to ask about their tobacco use, so how much do they smoke, how long have they smoked, and this will allow you to calculate a pack-year history, which is very important in understanding just how much they've smoked. The second is to advise quitting, so we want to mention all of the benefits and the good things that will happen if they were to stop smoking. For instance, they could save all of the money that they spend on tobacco products and use that for something else like a vacation, as well as all of the health benefits that will come when they stop smoking. The third step, and arguably one of the most important, is assessing the patient's readiness to quit. And so we want to ask them, hey, are you ready to make the step or the change in your life to stop smoking? And a lot of times that answer will be no, and that's okay, but it's important to help the patients who are ready to make a change in their life. And so we want to ask about prior attempts to quit, were they successful or unsuccessful, and then why, as well as some of the barriers that they may have to quitting. So perhaps maybe their family members or friends smoke and they're always around other people who smoke, and therefore it's a little bit more challenging for them. The fourth step is going to be obviously assisting the patient in quitting, so providing them resources, any medications, which we'll go through in the next couple slides, and just providing overall encouragement as their physician in their journey to go from a smoker to a non-smoker. And finally, we want to arrange for regular follow-ups as their physician to track their progress and really provide any resources or encouragement or help that they may need throughout this process. Some other helpful tips are listed on this slide, and arguably one of the most important is going to be setting a quit date, and this allows the patient to mentally prepare for a day that they're going to stop smoking. And so this may be a week in the future, a month in the future. It doesn't really matter when that date is. It's just important that they have a date and that they follow through with stopping smoking on that day. It's also important to address any barriers that they may have to quitting. So some patients may be afraid of the withdrawals or all of the side effects that may happen when they stop smoking. And as we previously mentioned, some people smoke because it's more of a social experience for them. Their family smokes, their friends smoke, and so they just are always around other people who smoke, and therefore the temptation's always there. So we want to make sure that we are addressing all of the reasons that they smoke and not just pushing them to quit. Another useful tip that we just talked about is to mention all of the benefits that come with smoking cessation. So some people will be more motivated by the financial benefits, so mentioning that they may save an additional $100 a month because they're no longer spending that money on tobacco products will be very helpful in reaching out to them. For some people it will be the medical benefits, so maybe they're breathing better or they have a less risk of cancer. And then another item that I have found to be useful in very select patient populations is that acupuncture may actually be covered and included in their treatment if they were to go through with a smoking cessation program. And so some people are motivated by having additional experiences like that. And another very useful tip that needs to be explained to patients is that smoking cessation can be a very long journey and does not have to be all or nothing, and it does not have to be done all at once. And so a very useful tip that was taught to me by one of my mentors when I was still in residency was to have your patients throw out 2 cigarettes every time they buy a new box of cigarettes. And so by the time they start smoking 3 or 4 packs, now they've smoked 2 less cigarettes than they normally would. And then slowly increase this number by 2, so it'll be 2 less and then 4 less and then 6 less until eventually you find yourself not needing as many cigarettes, and then we can talk about quitting smoking altogether. This is just a gradual way to slow the amount of smoking your patients are doing without having to go from 0 to 100 immediately. So hospitalizations are also a very key factor in patients who smoke because obviously you cannot smoke in the hospital. So if your patient has been in the hospital for 3 or 4 days and they haven't smoked, we can use this progress to help bridge them into a full-time smoking cessation program. Now, we don't want our patients to go into nicotine withdrawal while they are in the hospital, so we will need some form of nicotine replacement, and that's usually going to be in the form of nicotine patches, just because that's what's commonly available in hospitals. And one other point is that for patients who are undergoing elective surgeries, who will be in the hospital for a few days and cannot smoke, we want to use nicotine replacement therapy because it has been shown to have the least amount of post-op complications when compared to some of the other drugs that we'll go over in just a minute. Now let's talk about some of the treatments that are available to help patients stop smoking, and a very important and high yield point for your board exams is that combination of therapy and drugs, so pharm and behavioral or cognitive therapy, is going to be the most effective method at helping patients quit. So let's talk about the pharmacologic therapies because this is what you are most likely to get tested on, and there are 3 first-line pharm therapies for smoking cessation. The first is Varenicline, the second is Buproprion, and the third is going to be combination nicotine replacement, so a long-acting with a short-acting nicotine drug. And all of these therapies are going to need to be continued for a long period of time, usually longer than 3 months, or until the patient states that they are confident that when they are taken off of their medication, they will not have any form of relapse. And one exception to what we just spoke about here is that patients who classify themselves as light smokers, sometimes they say that they are only smoking in social situations rather than routinely, they can be treated with behavioral counseling or therapy alone. They do not need to have a pharmacologic agent, although if, as the physician, you believe they need one, it can also be added. So the first drug we'll talk about is Varenicline. It goes by the trade name of Chantix, and this is going to be a partial nicotinic agonist and antagonist. So the agonist effects are going to prevent withdrawals so that there are no nasty side effects when the patient stops smoking, and the antagonist effects are going to block the euphoric sensation that a patient would normally experience when they smoke so that there's less of a dependence on smoking. And this is really going to be the major pharm agent that will be used in patients who are trying to stop smoking, and it has additional efficacy in patients who have a psychiatric history, so maybe they also have schizophrenia or bipolar disorder. Then Varenicline would really be the drug of choice, and it's also safe for use in pregnant women, so you can really use it in just about anyone who's trying to quit smoking. As far as dosing goes, there are 3 stages for days 1 through 3. It will be half a milligram once a day. For days 4 through 7, it will be half a milligram twice a day. And then any time after that 8-day mark, it will be 1 milligram twice a day for a total of 2 milligrams a day. And no drug is without its side effects, so it's very important to know, both for clinical practice as well as for your board exams, that one of the major adverse effects of taking Varenicline is that it has sleep disturbances such as nightmares, sleepwalking, and sleep talking. It can also cause nausea. However, this is a very common side effect for almost any drug, and so because of that, it's unlikely to be tested that nausea is a side effect of Varenicline. It's more important to be familiar with the sleep disturbances as a side effect of Varenicline. The next drug we'll talk about is Buproprion. It goes by the trade name of Wellbutrin, and this is a dopamine and norepinephrine reuptake inhibitor. It's commonly used for depression, similar to how the SSRIs are used, but it also has an indication to help for smoking cessation. Now, Buproprion is not as an effective agent as Varenicline or nicotine replacement is for smoking cessation. However, it can be used if the patient cannot tolerate one of those other 2 medications, or if maybe they have a coexisting depression and they're trying to quit smoking. Then Buproprion would be a good agent because it can treat both of those with 1 medication. And for smoking cessation, Buproprion will be dosed in 2 stages. Days 1 through 3 will be 150 milligrams once a day. Then after that 3rd day, it'll be dosed at twice a day. And again, no drug is without its side effects, so Buproprion in the immediate phase after starting the drug, just like with the SSRIs, we can see an increased risk of suicidal thinking and behaviors, as well as unmasking of any mania or hypomania. So it's important to ask your patients if they are having any signs and symptoms of these 2 conditions, both before and while they are taking bupropion. And bupropion also increases the risk of angle closure glaucoma, and that is going to be throughout the course of taking bupropion, not just in the immediate phase. And it can also increase the risk of seizures because it decreases the seizure threshold. So this would be contraindicated in any patient who has a history of seizures or if they have anorexia. And finally, there are two other treatments that can be used if the patient cannot tolerate any of the first-line agents, and these are going to be nortriptyline, which is a tricyclic antidepressant, or cytisine, which is a plant-based derivative that has the similar mechanism of action as varenicline, which remember is going to be a nicotinic agonist and antagonist. And both of these are not very effective at helping patients smoke, but again, if the patient cannot tolerate any of the first-line treatments for smoking cessation, then we would consider one of these. And there are a handful of other treatments that have shown to have no efficacy in smoking cessation. However, they will commonly show up as options on your tests for your ITEs, your board exams, your shelves. So it's important to be aware that clonidine, SSRIs, nicotine vaccines, and transitioning to e-cigarettes have all shown to have no effect in helping patients quit smoking. And that brings us to the end of this module on smoking cessation.